There's to be a complete overhaul of the way care for elderly and disabled people is provided in England. The Department of Health says NHS and adult care services will have to be integrated within 5 years so that people get the proper care and nursing help they need. Our home editor, Mark Easton, reports on how older people and carers in Leeds are already benefiting from the approach.
He was across the hall like lightning, turning my effort down the stairs into slow-motion replay.
Elsie is a writer of short stories. Fiction comes easily to her.
And my heart sank, matching the dejected steel growing between my ribs as he surrendered the phone.
But the reality of caring for her husband in his final years proved to be the hardest job in her life.
I was really struggling. I hurt myself several times, cracked ribs and torn muscles and things like that.
It's a story familiar to millions of carers. But for Elsie, there was light at the end of the tunnel when her local NHS and care services in Leeds started working together. A coordinated approach that the government wants to see happen across England.
It changed my life beyond imagining, really. I felt lifted. It was like heaving a sigh of relief, you know, that this was there for you.
The pioneering way the gap between health and social care systems has been bridged in Leeds underpins a promise made jointly today by the NHS and local government. By 2018, people should benefit from a seamless service, whether in hospital or cared for in the community.
We know that if we bring these disparate parts of the system together to provide joined-up care for the patient, we can prevent the crises occurring and, critically, you save the system money.
The ambition behind today's pledge enjoys almost universal support, of course, but there's no significant new money to make it happen. Ministers actually think coordination will save money by freeing up expensive hospital beds.
However, there are warnings that with an ageing population, demand for care services is rising as budgets are being cut.
Social care is in financial crisis and we're seeing local authorities under huge pressure stripping budgets, and that support is being stripped away at the moment for older people in their local communities.
If the promise made today does lead to patient-centred support packages, it has the potential to transform the lives of those receiving care and those who look after them. But to work, good quality services need to be there in the first place. Mark Easton, BBC News.